everyone, and welcome to KSAU Master Talk. I'm your host, Dr. Nadine Musnid. Today, I am very honored to have Dr. Yánnis with us in this episode. Dr. Yánnis, his work focuses on how healthcare system change and how professionals adapt to innovation and how to bring evidence-based improvement into real world of healthcare. Welcome, Dr. Yánnis. It's a pleasure to have you with us.
It's a pleasure to be here. Thanks very much for the invitation.
Can you tell us more about your career journey?
Yeah, my career journey was planned from the beginning. Very well detailed and designed in advance.
Great.
No,
How is
I'm
it?
joking, actually. Because things happen very randomly at your life. I've never imagined, for example, that I'm doing what I'm doing now. So I started my career. This is my second career. I started as a veterinary surgeon.
Yes, I heard that.
And I worked for some time, and then I went to do my master's at Imperial College in the business school. It was the master in healthcare management. And then I did a project in Bosnia-Herzegovina. At that time, I volunteered to go there. It was after the war. It was in the news. So I was very excited to go. And it was a work that was done with the World Health Organization and the World Bank. And it was the reconstruction of the health system after the destructive war. And it was also part of the transition of the former communist or socialist countries in Eastern Europe to follow a more liberal or more westernized structure in their society. So as part of that health system reform, they were redeveloping their primary care system. And I focused on that. And this actually led to an offer to do some consultancy work with the World Health Organization and the World Bank in the region, and a scholarship from Imperial College Business School to do a PhD. And I said, why not?
Wow.
So, and that led to where I am now. So I completed my PhD at the business school on healthcare management and organization studies. So I had two supervisors, Professor Rifat Atun. I'm very grateful for his guidance. He's now professor of public health systems at Harvard School of Public Health. He introduced me to more kind of health system thinking and the organizing of care at system level. And also Professor Nelson Phillips, he was more on organizational studies, a scholar, strategy focused at that time. And he is an expert in institutional theory, and he introduced me to this concept of social institutions and how valuable they are in guiding our behavior and work in society, but also in healthcare.
This is a big shift.
It is indeed.
What makes you interested in leadership and healthcare system?
Yeah, good question. I think it was, I started looking that probably you can have higher impact if you engage in the structure of a whole system, if you see that things do not work, and you can help by making more structural changes at system level, that will impact more the lives of people and patients and will improve care much more than on an individual level whenever you're a clinician, which is great work and very valuable. And we all, we are craving for this help whenever we need it. But I thought that there's also an opportunity to see, to see the broader perspective, to see things and how work is being organized, how systems are designed, how people and units interact and collaborate, and how can you create the structures to enable that to work in an effective way.
So making change is really difficult. In your experience, how difficult to make change in healthcare system?
Oh yes, change is one of the most difficult things you can attempt to.
Yeah, I imagine the change always difficult. So what about healthcare?
Yeah, healthcare is even more difficult.
Yeah.
I would say, and see, the first thing is that change is something that as individuals we tend to say that we want it and we crave for it, but in reality we don't. We are kind of, as human beings, we really like stability and prediction and control in our lives, and we do everything that we can to create routines and predict things
Exactly.
and have stability.
Even if we said a different thing.
Exactly. Yes, absolutely.
Comfort zone.
Yes, the comfort zone. So stability is kind of an innate characteristic that we have as a species, and we always try to create situations that at least we have the perception or the illusion that things are stable around us. So to upset the status quo and really make meaningful change, it's really hard. There is a lot of change that happens, but that change is more superficial. And so there is constant change. If you ask people in healthcare, they will complain, oh yes, there's another reform. There's been a reform every 6 months. Every time that the new minister comes in, every time that we have a new leader in an organization, every time that they're kind of a management team changes, they will initiate their own kind of legacy reforms, the legacy of restructuring, and things constantly change. But the reality is that this change is only kind of at the structural level, or sometimes in name only. So there is no substantive, profound change that really will make a difference, and people will feel it in how they deliver service. If you're a patient, how you receive services. Things at that level remain very stable, actually. Although there is a pretense that things have changed. We create new organizational units.
But in the ground, it's not.
The groundwork is still the same. So the routines, the behavior of people doesn't change.
How do you deal when you find this?
Yeah, I was trying to understand why is that the case. I was intrigued by this, and I started looking initially at the more kind of higher system level issues, and from starting at the macro level, I ended up into the micro level of focusing on the individual. So the study that I did initially for my PhD looked at the primary care reforms, how the primary care reforms were introduced in 5 different Eastern European countries that were former, 2 countries that were former Soviet Union countries, like Moldova and Estonia, and 3 countries that were in former Yugoslavia, the Federal Socialist Yugoslavia at that time. So at the time of transitioning to more westernized, liberal, democratic regime, they also changed the whole society, really, but part of that transition was also in their health systems. And then at that time, I saw the main problem, the main challenge at the time was, how do you introduce this kind of a new model? So they introduced the model of family medicine or general practice, and that was kind of innovative for these countries because they had very strong primary care systems, but in a very different organizing principle. And then I ended up looking at how individual clinicians really reacted to this, and they became a different type of clinicians. How did you persuade pediatricians or gynecologists that they were in primary care? At that time, they had narrow specialists in primary care providing services. So as a patient, you could go directly to a narrow specialist, like a dermatologist, a cardiologist in primary care. And then you had a second level dermatologist or a second level cardiologist in secondary care, and then a third level, more specialist at their kind of university hospitals or the institutes. So then they wanted to replace this narrow specialist in primary care that provided a lot of fragmentation, duplication, a lot of excess, and people were not really using the skills of specialists for treating minor cases. So they want to replace all those narrow specialists with a kind of a generalist type of doctor, the general practitioner or family physician. And then I was really intrigued. Initially, I was not planning to look at that level. But then I was really intrigued by the fact that some of those doctors, they actually changed. And I could imagine that would be really difficult for someone that has been trained all their career to become a gynecologist, a pediatrician. How do they become a generalist? And then you're a doctor, and you know that as you specialize, your status and prestige in the profession increases. And you start as a generalist, as a medical graduate, then you go to the residency, you specialize, you become more expert, you increase your competence, your status and standing in the profession. And now you ask this kind of specialists to go the other way around. So, and that was interesting for me, very intriguing. I was really curious to see that. How did that happen? How did these people work it out? and then I started, my initial focus was at the macro level, and then I ended up looking at this micro level processes of how the identity of these people.
This is a very smart way.
I was just, driven by curiosity in what I was exploring at that time.
So you worked in several countries.
Yes, I've done research in a number of countries.
Is there one successful story you would like to share it with us, or you think this was interesting?
Well, there are many successful stories that I've seen, but I was really impressed with I was looking at these countries, for example, that they restructured completely their care system. And just continuing that story that I started saying about the 5 countries that I studied, I was really surprised by Estonia at that time. So I was in my late 20s when I went there, and I went to the Ministry of Health, and I was probably the oldest person. And the average would be in every other country would be people in their 60s, maybe late 50s, that will hold the key positions. But the country there, they actually ended up to being the most successful in completely transforming their care system in a very short period. Okay. And what they did is that they wanted, because they wanted to do a fundamental radical change, they wanted to completely restructure the system. They replaced all the old kind of guard, the people that they had institutional memory of the previous situation, with younger, ambitious and eager individuals that they were really driven to make Estonia look more like the Scandinavian countries or the Western Europeans that they felt that they were part, they belonged to as a nation. And then it was harsh for a lot of people at that time. So because it was not an easy task to do, and sidelined a big part of the society. So the people that they grew up and they were used to work in the previous system, in a way they were a bit sidelined. And they gave this opportunity to the younger generation to have a radical change. And that was fascinating because I could see
it is
huge change.
What was the role of leadership in such a story? That's a very good question, actually. Yes, I think that decisiveness and how they introduced this new innovation to them. It must be a new skills and new.
Yes, it was. So first of all, they were very decisive. I think that was a key. So they had a clear vision where they wanted to be, and they actually implemented that vision with making difficult choices, because that's the leadership kind of quality.
Exactly.
You have to make difficult choices. If it's easy and you please everyone, that's all right. This is, you just administer things and you keep things as they are. Yeah. But if you want to upset the status quo, you're going to you need to have some breakdowns. So you need to maybe you're not going to be able to satisfy everyone. Never. So you have to some invested interest in the previous situation. They need to be affected if you want real change to happen. And this opened also my eyes to the importance of social institutions. So if you want, because we mentioned before that most of the change that we see is kind of more superficial, structural at the administrative level. So we create a new organizational unit, we rename a post, we give a new role or a new duty to someone or in a unit, and we think that this is going to work on their own. Okay, we have all these new agencies, the new accounting lines, the new reporting lines, the new financial mechanisms, sometimes new legal frameworks. But this kind of creates a new structure, but doesn't necessarily change things on the ground.
Yeah, exactly.
And the problem is that people see the people that they this is the easy solution for most of their kind of leaders that they have. They show that they've made structural change, so this is evident. Mm-hmm. So I created this unit, I gave this budget to this area, I highlighted, I create this reporting mechanism, this accountability structure. Now things are going to be more transparent, more accountable, but they stay at that level because the view of organizing is more of their hierarchical bureaucratic, mechanistic form. This is kind of the vision when in their mind. When they think about how you organize something, that's the view that comes to their mind. This is how they see the world. But if you ask organizational theorists, they will tell you, but in most of the cases, this kind of restructuring is really restructuring by tinkering. So changing the boxes in the organizational chart, no real change happens there because it doesn't change the underlying assumptions, the norms, or the behavior of people. And this is what really matters.
What they should do to reach this change.
Yeah. So then you have to work with social institutions.
Okay.
So you need to create a new institutional order. That means that people need to start thinking in a different way. They need to start putting meaning and explain a new situation in a different way. So you need to change the kind of the mindset, the logic, the organizing logic behind the system. For example, in Estonia, they restructure the system. But then once you make a very radical restructuring of the health system, you need to justify it. Why do you do that? And the justification can come. You need to create the supporting values. Why do we have to restructure this system? The argument was that the old system was not really ours. It was imposed by Russia. It was imposed by the Soviet Union. Now, by doing that, we rediscover our national identity and our national character that was suppressed all these years. So we are actually not betraying our old system. The old system was imposed on us, and now we are kind of resurfacing and we create our real own system. So this, you see now that they make the connection with their national kind of pride and the national tradition, and they legitimate the new structure based on that change that happens there. And the values, the broader societal values. And they also wanted to appear modern and innovative. And the reforms that they promoted were justified as that. So you see the new logic is kind of explains why we have the structure, why it should be the structure, why is it better for the people, because it's more innovative, it's our own, it aligns with our own values, it aligns with our own needs as a country, and we feel proud of creating a system that is more equitable, it's more sustainable, and it's more innovative and aligns better with role models that we would like to follow. And by doing that, then you create kind of a new organizational or institutional logic that supports the new structure. So this kind of justification, the legitimation, is the beginning of a new institutional order. So when you start doing that, then you start to train people in a different way. Then you start educating people in a different way. In Estonia, for example, they introduced very innovative for the time methods in educating their students. They use simulation for the first time. They changed from the old Soviet gray buildings that went to really beautiful, well-designed Scandinavian minimalist clinics that they looked really completely different from
dramatic change.
Yes. But that made people feel that we are actually participating in something that is innovative, modern. It's better. It's more engaging. They got momentum to follow through.
Well, the life now changing so fast. Is the healthcare workforce ready to follow this change in the future? What do you think should we change, or the most important thing that has to be changed?
Yeah, we're facing major challenges with her system and also the workforce in the healthcare system. So as you said, yeah, there's major change. There's disrupt technology that comes more and more becomes mainstream. You see AI, machine learning, and there will be Internet of Things, blockchain, cloud computing. All this will create a fundamentally different environment in healthcare in the future. But also we have policy pressures for cost cutting. We have patient expectations. We have demographic changes. In most of the developed economies, we have an aging population. Chronic conditions and comorbidities become more prevalent, and that requires a different type of care. And then in the workforce, we are not prepared for this situation. And there are kind of three major challenges that we face, or at least these are the three challenges that we identify in the literature, but also it also forms part of the agenda in the team that I'm also leading, and I'm also working with other colleagues at the university where I work. So the three challenges is that first that it's like we have a shortage of healthcare personnel. We don't have enough people to meet the growing demand for health services. The second issue is that there's a well-being crisis at work.
Yeah.
So we have lots of burnouts, people are demotivated, we have high attrition rates in healthcare, in workforce. So many people quit their jobs, they move from full-time to part-time, they feel less satisfied and motivated when they work, they feel less valued, and sometimes they feel underpaid, especially in social care. This is quite prevalent. So we have that issue as well. So workforce shortages, well-being at work, and also there's this a restructuring, a transformation that happens in the way we organize care, and that creates gaps in the skills of our workforce. So now healthcare professionals, they have to work with very advanced technologies, which they evolve all the time. So they need to catch up and to keep up with all these complex developments in the technology, and that requires reskilling themselves all the time. We have a huge amount of medical knowledge and research knowledge that is being produced all the time. So the medical knowledge is almost doubled every few years. So that requires high levels of specialization and narrow technical expertise in specific fields. That requires also constant development of skills, but also new professional roles or new occupations that they need to emerge to fill in those gaps. And there are kind of other similar changes that happen because health systems are transitioning. There is economic transition, social transition, demographic transition, social transition that the systems go through, and the needs of patients and communities change. So we need to adjust the care provision to those new needs, and that requires also reskilling and adapting our workforce in terms of skill mix.
So if you had a chance to change one thing in a healthcare system, what would you choose? I know it's a hard one, but if you have the chance to change only one, what's the top priority?
I would try to put more emphasis into prevention and promoting good health early on. So if you can intervene early on, I think your investment is going to pay off much more. It's hard because there are vested interests. We have invested in creating a very high specialized and elaborate structure in health systems. And these people that they're at the high specialist end are our top experts, and they have dedicated their careers to become this type of expert, and we're very grateful for that skill. But they have become very powerful when they kind of control the system to continue following that paradigm. But that paradigm is not sustainable in the long term. And we need to kind of find a way to reverse or at least rebalance part of that and focus a bit more on prevention and health promotion. Sometimes that means also moving outside healthcare. So we don't need to invest so much in new hospitals. Maybe it's better to invest some of the money to create a better environment for people to walk and enjoy and do more physical activities.
Yeah, we're doing it here.
Yes?
Yeah. You might saw the campus in here.
Yes.
Yeah.
So what are some examples where there's been more encouragement to go outdoors for people to...
Especially if you saw, because we have the weather is not
yes.
easy. So we connected by tram. All the
Good
buildings
idea.
connected internally. So you can go even walk within the buildings with the whole campus. We have 2 different, or 3 actually, gym area,
Excellent.
swimming pools. And
So people
we
like
do
they're
have a lot of
encouraged.
activities in here that run by faculty, by physician, by students. So that's, I think, I see it encouraging, make us more glued together.
Yes, it helps also to put people together, but also, as you say, it's very good that the people
And being all together in one campus, the hospital, university, the housing, research center, this is make us like a small village.
That's a nice
We know
feeling.
each other, we talk to each other, we can walk around, you see your colleague around. So I think this is one of my favorite thing about the place I'm working on.
Yeah, that sounds it's also very nice.
Yeah.
And I was surprised that when you showed me yesterday from the balcony here, it's actually in the desert.
And it looks very nice.
It looks very nice for being in the desert. I was really surprised because when you're
modern,
up there,
nice, in a simple way.
It
even
is.
our students enjoy it.
Yes, and if it's when the weather allows, I'm sure that it's really nice to hang around, walk around.
You will see people biking as well around here.
Excellent. That's really great.
And we have the Deanship of Student Affairs. They always have activity for the students, and we have the employee relationship. We do have a lot of those activities as well, which support the system. My last question to you, maybe it's just to wrap up. You have a great experience. What's your suggestion to the new professionals? The young one, the one who's going to start or planning to start.
Yes,
can we catch them at that point?
That's a very good. This is like being proactive. That's a very good strategy. And yes, I think we need to focus. These are the people. These are the future of our of our systems, of our societies. So we need to kind of really give them all the help that we can to lead for them to lead a better life.
How can we give them this help?
So for the people, do you want was it your question about the people that they work in
either
healthcare,
the young that
professionals?
start working or they are planning to work?
Right. Yes, they need to be prepared.
See the younger generation.
Exactly. Yeah, that's a really good focus to focus on that segment. I think they need to be prepared that they will be working in a very different environment and very different society to what we are now. So we see a major transition that is happening, and what we call the digital transformation. But the digital transformation means things are going to be very, very different in the future, and they need to start being prepared for that. And there are 2 ways. So they cannot avoid the digital future. This is the major change that happened. Yeah. So, and the thing is, they can be prepared by focusing 2 opposite directions, in my view. If they are really young people, then they kind of plan their career. One way is that they need to become kind of more technically involved in understanding at least the basic principles of this new environment of a digitalized future. So they need to understand. They don't have to become necessarily people that work in healthcare. They don't have necessarily to become top experts in computer science, data analytics, but they need to understand in depth kind of the structure of these new technologies, and they can work the ethical implications, the practical implications for their work, the possibilities, but also the dangers of these technologies. So they need to become experts enough to have a proper understanding and engage with these technologies, or they also need to have a more critical stance and kind of and be able to offer to work with the technology, but also work without the technology at the same time. So being as a kind of a critical analyst.
Don't you think they are already flexible for doing this more than us?
Absolutely, they are.
Yeah. I think they are halfway ready.
They're
we just
digital
need to
natives.
give them the direction.
Yes, we call them the digital natives. They're the generation that they grew up into this networked, connected society. Digital technology has been everywhere in their lives, so they're far better equipped and more familiar to work and engage in that new world.
I'm putting a lot of hope in what's coming.
Yes, it's hope, but also we need to be a bit cautious as well, because the super technicization of our society and our healthcare can also hold a dark side as well.
So we need someone like you to guide them.
Well, I don't know if I'm the right person, but
you are. It was a pleasure listening to your story and your advice. Thank you very much for being with us.
Thank you very much for the kind invitation. It was really a pleasure to be here and have that discussion. Thanks very much.
And thank you, everyone, for tuning in. This is KSAU Master Talk. Stay curious and see you next time.